Hi class, I hope you're all doing well. Well, today Katie and I will be presenting on Marfan Syndrome. Okay, so what is Marfan Syndrome? Marfan Syndrome is a genetic disorder that affects the body's connective tissue. Connective tissue holds tissue, body cells, and organs together. Connective tissue also plays an important role in helping the body grow and develop. What causes Marfan syndrome? Since connective tissue is made up of proteins, the protein that plays in Marfan syndrome is called fibrillin 1. Marfan syndrome is caused by a defect or mutation in the genes that tells the body how to make fibrillin 1. That results in an increase of a protein called transforming growth factor beta, TGFB, which causes problems in connective tissues throughout the entire body. Symptoms of Marfan syndrome are back pain, heart murmur, any heart problems, bulging or sunken chest, abnormally raised roof of mouth, abnormally long fingers, disproportionately long arms, eye problems. The lung and nervous systems may also be affected. Expansion of the main blood vessel that carries blood away from the heart to the rest of the body can be life-threatening.
So the treatment for Marfan syndrome is that, well, it can't be fully cured, but there has to be a limitation on physical activity. You have to take medications to keep blood pressure low. You need a heart valve repair, which is an alternate to heart valve replacement. A back brace to support and stabilize back, but sometimes surgery is needed to repair chests that stick in or out. Contacts or glasses to repair or assist with vision. Sorry. Medication called beta blockers used to make heartbeat slower and with less force. Well, the affected age groups is that you're usually born with it. Usually born with the disease because you can inherit the syndrome from a parent who has it. There's a 50% chance that someone with Marfan syndrome will pass along the genetic mutation each time they have a child. And men and women of all races and ethnic groups could get this syndrome. And some could be the first to have the syndrome in their family. So when this happens, it's called spontaneous mutation. The microscopic level of Marfan syndrome is that, well, I couldn't really find much, but the bones and ligaments grow extra long because which is the connective tissue that hold the joints together, becomes stretchy like loose rubber bands, and the bone density becomes very weak. And as you can see in these two pictures, this is the Marfan syndrome hand, which is really longer compared to a normal hand because the bones are stretched out, and the ligaments in the bones, like the connective tissue, become stretchy, like it said, like loose rubber bands. And a fun fact is that a former Baylor basketball star named Isaiah Austin is diagnosed with Marfan syndrome. See? And he plays basketball.